Dave is a hard-working professional, and a loving family man. With COVID-19 awareness spreading as fast as the coronavirus itself, Dave is doing his best to keep himself and his family safe and healthy during the pandemic. One day, when Dave starts feeling unwell, he calls his primary healthcare provider, who is already dealing with an overload of COVID-19 cases. Since Dave has flu-like symptoms, he is asked to download ReCOVer, a remote patient monitoring app, optimized for rapid response during the COVID-19 pandemic. ReCOVer enables patients, caregivers and healthcare personnel to join forces to win the war against SARS-CoV-2. Patients can communicate with hospital and emergency services, and access trusted COVID-19 resources online. Through its COVID-19 self-assessment triage, ReCOVer helps reduce the burden on healthcare facilities, while maintaining quality of care. Using ReCOVer, patients can log their medications and how they are doing, while keeping caregivers and healthcare providers informed. Basic patient data and medications are all that are needed to realize the complete potential of ReCOVer. These can easily be fetched securely from hospital systems using a variety of integration and authentication techniques. As requested by their healthcare provider, Dave, along with his wife and caregiver, Elena, use ReCOVer to conduct a self-assessment of COVID-19 symptoms so that Dave's case can then be triaged by his healthcare provider. The initial questions first check for basic COVID-19 symptoms. Since Dave has some of the basic symptoms of COVID-19, the next set of questions check if he is experiencing any indicators of an emergency. Since Dave doesn't seem to have any emergency indicators, the next set of questions check for any underlying conditions which may put him at high risk. The assessment shows that Dave is at moderate risk and asks him to get in touch with his healthcare provider. At their end, Dave's healthcare provider sees his risk profile and symptoms. This leads to a telehealth consultation, where the clinician performs a diagnosis, perhaps suggests a COVID-19 test, and then prescribes medication for clinical management at home, for Dave's suspected COVID-19 infection. With Elena caring for Dave at home, he adheres to his medication schedule which they record in ReCOVer. They record and track his body temperature. Also his respiration rate, by observing at rest, the number of times his chest rises per minute. Dave and Elena use a pulse oximeter, optionally provided with ReCOVer, to measure his blood oxygen saturation level and record it in the app. They also keep track of his loose bowel movements. By revisiting his health journal, they see how his health has improved over time and keep track of the effects the medication has on him. Notifications on key clinical events and thresholds are sent to Dave's healthcare providers so that they stay informed about his well-being at all times. Using ReCOVer, Dave and Elena also see how well he has been adhering to his medication schedule. They can see how his fever is trending. They can trend his respiration rate. They see that his blood oxygen level shows a steady trend, which is reassuring. And they also see a downward trend in loose bowel movements. Dave's healthcare providers monitor him through ReCOVer's clinical trends and analytics based on data gathered from him. Telehealth consultations continue between Dave and his clinicians. By looking at medication adherence and health parameter trends side by side during these sessions, clinicians are able to correlate them and decide on subsequent courses of action to be taken to improve Dave's health. After continuous care for a couple of weeks, Dave is now back on his feet. Although he will take a while to be back to full strength, he is happy that he has successfully defeated the SARS-CoV-2 virus, thanks to his healthcare providers and clinicians, his loving wife and caregiver Elena, and ReCOVer, for bringing it all together. In a new rule in 2020, CMS made a number of changes to how they cover remote patient monitoring, or RPM, both for the duration of the COVID-19 public health emergency, as well as permanent fixes. Going forward, RPM can be used for patients with acute or chronic conditions. Additionally, for the duration of the COVID-19 pandemic, CMS has clarified that RPM can be provided to new as well as established patients. CPT code 99453 covers remote monitoring of physiologic parameters, initial setup and patient education on use of equipment. CPT code 99454 covers initial collection, transmission, and report or summary services to the clinician managing the patient. CPT codes 99457 and 58 cover remote physiologic monitoring treatment management services. CPT code 99091 covers collection and interpretation of physiologic data. ReCOVer, an indispensable weapon in humanity's fight against COVID-19.